Welcome back to Great Day on this Thursday morning. It's a beautiful one, too. I want to get right to our next guest because there's a lot to unpack here, and I think this will be a really interesting conversation that will speak to so many of you. I want you to welcome to the Great Day couch here Dr. Sean Branham of Premier Healthcare. He's coming back to the show, and he's here to tell us more about his holistic, natural approach to digestive problems. How are you, doctor?
I'm great. Thanks for having me.
I hear this from so many people. I feel like now more than ever, I don't know if it's because we're eating more processed foods or what have you, but we're obviously more aware of digestive problems. What are some of the common symptoms you see?
Bloating, abdominal pain, cramping, constipation, diarrhea, acid reflux, headaches, memory issues, brain fog, skin rashes. It's quite a large list.
So much of it ties back to our gut. So
Right.
what's the more traditional approach to treating digestive problems?
Well, traditional approach is usually they start with blood work and they don't find much. Then they go to endoscopy and colonoscopy and they still don't find much. So the default diagnosis is IBS, and then medications are aimed at alleviating symptoms, but they never really look for or find the cause of the problem.
Which leads me to my next issue. So many patients out there frustrated and not getting results with traditional medical care. Why is that?
Well, the doctors are following a standard of care. They're running the same tests on every patient. They're giving the same medications, which means the patients are getting the same results. And like I said before, no one's dug deeper to find the cause. So how can you expect to fix a problem if you don't know what's causing it?
So before we get to what makes your approach different, give me some of the causes of digestive problems.
So some of the causes are things like nutritional deficiencies, hormonal imbalances, gastrointestinal infections, food allergies, food sensitivities, intestinal permeability issues, inflammation just from, like you said, the standard American diet.
Yeah, right. So let's talk about how you're really kind of shifting the paradigm here. How is your approach different in treating digestive conditions? And just as importantly, what kind of results do your patients see?
Good. So what we do is we use very extensive diagnostic testing, and it's aimed at finding the causes, right? We then take each patient's test results and we customize a diet specific to that one patient, and we customize an all-natural treatment plan based on research and those test results. So our patients get results they don't get anywhere else. They get rid of their bloating, abdominal pain, cramping. I mean, big things that we hear is like, my nails are growing again, my hair is thicker than ever before, I'm getting haircuts more frequently, I sleep better. I mean, they get rid of all of their symptoms and get their lives back.
Because again, so much stems from your digestive health overall. This seems like an odd question to ask, but I'm asking with a reason. Do you take every patient that comes into your office?
We do not. This type of treatment plan is not for everyone. It's hard. Diet is one of the hardest changes you'll ever make.
Yeah.
It affects multiple decisions every single day of your life. So what we do is we qualify every patient because this is not for everyone.
I appreciate that, though, because I'd rather have that information up front and you tell me, listen, there are things that could help, but it's not exactly what I do, so we're better seeking other options.
Patients
here.
love it because they know if they become a patient, they will get results.
Yeah, there you go. There you go. Dr. Branham, thank you so much for stopping by. We appreciate it. So to see if you qualify for a complimentary consultation, call Dr. Branham's office right now. Here's the number, 314-647-1384. Or here's a website you could check out, too, for more information, drshawnbranham.com. The first 20 callers who qualify will receive a complimentary consultation. Laura, this is not just the standard blood test and what did you call it, standard of care.
Right.
He's really going to do some sleuthing to try to find out what's happening with you.
And that is great news.
Yes.
Thank you very much, you guys.